Normally, a person develops cataract around the age of 60. It is not compulsory because a person with diabetes can have cataract below the age of 50 also. But normally, what we say is a person starts to develop cataract around the grade of 1 at 60. By around 70, the grade of cataract has increased to 4 or 3. By around 80, the cataract has become very hard and has reached the final stage of grade 6. In my experience, I have seen that patients who are informed that they have cataract at 60 never choose to operate at that age. It is because they feel the cataract may remain stationary or due to some other reason. And what is the problem in postponing cataract surgery? The problems are many because when the cataract develops, they have difficulty reading. Watching TV and seeing news on the TV also becomes a problem. And social life or outgoing life is also curtailed to some degree because they cannot drive that freely, and especially driving at night becomes a problem because of the severe glare due to cataract. So a person with cataract at 60 who opts to do cataract at 70 sacrifices 10 years of quality life. So loss of quality life is for 10 years. In addition to that, when they reach 70 from 60, there can be other diseases that also happen along the way, like diabetes, blood pressure, or heart problems. So a person who undergoes cataract surgery at 60 has a greater risk when at 70 or even greater risk when at 80. This is due to the increasing density of the cataract gives rise to several complications inside the eye. Modern eye surgery is very safe, but still the density of cataract plays a role in the safety of the cataract surgery. In addition to that, a person who at 60 or 70, a person at 60 has lesser systemic problems like diabetes or hypertension as compared to a person who has more diabetes or hypertension or heart disease at the age of 60, 80. So what are the problems other than eye-related problems that can happen when you have cataract? One of the major things that we notice is a person who has a cataract who enters a bathroom cannot see if the floor is wet. That is because of decreased vision. He cannot make out the slight glimmer of the water on the tiles. This causes the person to slip and fall and result break the hip bone or the spine. It is not old age that causes the fall. It is rather the cataract that causes the fall. So it is ideal and recommended too that when you hear that you have cataract, try to operate it within 1 year of that.